Historically, one of the problems with traumatic brain injury, in particular mild traumatic brain injury and the persistent symptoms that result from it, persistent post-concussion syndrome, is that the medical field has pretty much ignored the original science that was developed in mild traumatic brain injury. Many years ago, going back to the 1950s, in animal models and even the human situation, essentially what was shown is that the basis, the injury in mild traumatic brain injury, is a physical disruption of tissue. And in particular, it's the white matter tracts in the brain, which are the connecting tracts. Every neuron has branches where other neurons send their processes, touch them, and electricity gets conducted through a chemical there, the neurotransmitter, and then all those little electrical charges get summed up in the cell body, and they go out one route called the axon, which then branches many times like the root system of a tree, and they go and they touch other neurons' branches. So you have this kind of circular circuit, if you will, of electrical signals. Those white matter tracts, the roots, are banded together, millions of them, in broad tracts called the white matter tracts in the brain. Turns out that 63% of the structure of those white matter tracts is a fatty substance called myelin, which means that it's flimsy. It really has very little structure to it. So when the brain is shaken, meaning the brain is hit, traumatic brain injury, there are torque effects on these long white matter tracts, and it disrupts the internal part of it, and eventually they can break. In other words, there is anatomic damage. With that, you also can damage the tiniest blood vessels in a variety of ways, but it is a disruption of the normal architecture of the brain. And since it's all conducting electricity, it's an interruption of electrical transmission. Essentially, what you now have is a brain with lesser bandwidth. You're trying to send the same amount of signals over lesser pathways. And it's easy to overload it, which gives you the symptoms of people who have traumatic brain injury and the persistent concussive symptoms where they can't tolerate crowds and noise and high stimulation environments, children. But surprisingly, even though this microscopic damage in mild traumatic brain injury was known since the 50s and 60s, the syndrome of persistent symptoms after a concussion are defined in the psychiatric manual. It's a psychiatric condition. And with mild concussion, usually the immediate symptoms are transient. They last a short period of time, maybe days. And then people seem to get better, to the extent that it's always been thought that 90% or more get better from a mild traumatic brain injury. And if you have persistent symptoms, those other 10% got put into a psychiatric category. It is now appreciated that this is a biological organic disease. Traumatic brain injury alters the brain architecture, damages it, affects electrical conduction, and that's responsible for all the symptoms that people have. And that, yes, the brain tries to heal it, but it's an accommodation that occurs. And there is some persistent loss of brain tissue. And that can even be brought out under stress conditions in those who have completely recovered. And this was done in 1980 when they took two groups of college students, one that had a previous mild traumatic brain injury characterized by loss of consciousness, meaning a significant level of injury, but they recovered. And 2.5, 3 years later, when the study was done, they were in college, functioning well, had no symptoms, no complaints. And they matched them to an equal group, same age of college students, who were also asymptomatic, had neurological problems. And they tested them, did some cognitive testing. Then they put them in an altitude chamber and took them to 11,800 feet under hypoxic stress conditions, like if you were hiking in the Rockies, going up to a 14,000 foot peak hiking. They retested them at 11,800 feet. And what did they find? The group that had the previous concussion had a decrease in cognitive performance. In other words, the injury was still there, and it could be brought out under stress conditions. So now think of sleep deprivation. What happens in people with mild traumatic brain injury and disrupted sleep? Eventually, you have sleep deprivation, and this is most apparent in those with PTSD. What has PTSD been defined as? It's a psychiatric condition. It's an extreme anxiety disorder, defined in the psychiatric manual. But in fact, what's been found is that psychiatric condition is deeply embedded in our brain tissue. In fact, almost inextricably inseparable from the traumatic brain injury in those who have traumatic brain injury and develop PTSD. And what's now been found, and the conclusion that was drawn after a systematic review we performed of the hyperbaric oxygen studies in PTSD, is that based on what was seen with the imaging, that PTSD can no longer be considered exclusively a psychiatric disease, that it is an organic brain syndrome, which really is what all psychiatric disease is. It is emanating from physical, chemical dysfunction in brain tissue. So when we're using hyperbaric oxygen, what are we doing? Hyperbaric oxygen has been used for 365 years now and found success in treating wounding conditions and inflammatory or infectious conditions. And traumatic brain injury and PTSD, they're wounding conditions of the brain. And that's why hyperbaric oxygen is so effective in treatment of them. We're treating the wounds.